Hello, my name is Harsha George, or Harsha George, as some of my Aussie friends call me. This is session 3A of the Acceptance and Commitment Therapy series. For those who have already watched session 3, this will be a repetition. As I decided to break the session down into 2 segments as it was too long. I started publishing this presentation for my colleagues who wanted to familiarize themselves with ACT techniques because of its acceptance as an evidence-based model by various organizations, model of therapy by various organizations like the WHO, the APA, and so on. My ACT knowledge is limited to the review of resources made available by Dr. Russ Harris. In this session, I would like to introduce some of the main principles of ACT. So there are 2 basic aims in ACT. One is to create a rich, full, and meaningful life, and the second is to be psychologically flexible. When you live a full and meaningful life, that involves experiencing the full range of emotions. And so the aim is not to eliminate distress, but to increase your flexibility to sit with distress. Risks or informed consent. ACT is not one of those therapies where we just talk about your problems. ACT can be hard work and involves experiencing significant distress. Learning, applying, and practicing skills in between sessions requires commitment. Therapist and client roles. Clients and therapists are on the same boat. Therapist's life is not completely in order. The client and therapist are both climbing their own mountains. Therapist has not reached the top and is not having a rest. From where the therapist is on their mountain, they can see obstacles on the client's mountain the client cannot see. Therapists can point those out to the client, and the client can then choose some alternative routes around them. Operating principles. ACT is acceptance focused and whole life focused. It is not focused on very specific problems. Problems are not ignored but are looked at in a broader context, in the context of the ultimate picture of life, or the big picture of life. We try not to use labels, even though that can be tricky when you have to write reports for funding bodies. But in any case, we try not to use labels because as soon as a private experience is called a symptom, it immediately sets up a struggle with it. So the aim is to transform our relationship with our thoughts and feelings so that we no longer perceive them as a symptom. Although uncomfortable, they are harmless and transient. Our thoughts and feelings are harmless and transient. This is another concept that we need to clarify before we begin therapy. Self has an identity that is separate from the body and mind because it can observe thoughts, feelings, and sensations. Self is the locus from which a person's experience unfolds. Self can also be understood as the observing self or the core you. Self is a context from which we can take different perspectives about our life or the areas of our life. I recommend watching the YouTube video called Internal Struggles, where Dr. Russ Harris explains this concept using a chessboard metaphor. So before we go into the next session on the problem of control, I recommend watching these videos by Dr. Russ Harris on YouTube called Struggle Switch and the 3 Happiness Myths. In the Struggle Switch, he talks about how struggling with our feelings can amplify them even more. Or struggling with distress or anxiety can amplify even more. In the three happiness myths videos, he tries to bust three myths related to happiness. The first one is happiness is the natural state for human beings. The second myth says happiness means feeling good. And the third myth is if you're not happy, you're defective. So I would like to discuss more about the problem of avoidance in the next session. So please look out for the next session.